Incision, anal septum, infant. The physician incises a congenital anal septum. The physician identifies the anal opening and septum in the infant. The septum is sharply incised. Incision of thrombosed hemorrhoid, external. The physician performs incision of a thrombosed external hemorrhoid. The physician identifies the thrombosed external hemorrhoid. An incision is made in the skin over the hemorrhoid and the thrombus is removed. The incision is left open for continued drainage. Snip incision of lacrimal punctum. The physician administers a local anesthetic at the lacrimal punctum and uses sharp scissors to snip the lacrimal punctum, usually posteriorly. A dilating probe is introduced to ensure that enlargement of the punctum has been achieved. Corneal relaxing incision for correction of surgically induced astigmatism. When a previous surgery, e.g., for insertion of an intraocular lens or a corneal procedure, results in astigmatism, the physician at a later date returns the patient to the operating room to correct the problem. The physician retracts the patient's eyelids with an ocular speculum. In corneal relaxing, an X-cut is made on the cornea to repair the error. Slices along the X are removed and its edges are sutured. A tendon sheath is a layer of synovial membrane around a tendon. It permits the tendon to stretch and not adhere to the surrounding fascia. Tendon sheaths keep the tendons in place. It has two layers: synovial sheath, fibrous tendon sheath. Extensor tendon sheath, a muscle whose contraction extends or straightens a limb or other part of the body. Flexor tendon sheath, a muscle whose contraction bends a limb or other part of the body. Incision, extensor tendon sheath, wrist, e.g., de Quervain's disease. The physician incises the extensor tendon sheath over the wrist. The physician incises the skin just proximal to the anatomic snuff box. The tissues are dissected and the extensor retinaculum of the first extensor compartment is identified and incised. The incision is sutured in layers. Incision, flexor tendon sheath, wrist, e.g., flexor carpi radialis. The physician incises the flexor tendon sheath over the wrist. The physician makes a radial incision. The tissues are dissected to the tendon sheath. The compartment is identified and incised. When incising the flexor carpi radialis, FCR, the tendon sheath is opened proximal to distal. The fibroosseous tunnel is released along the ulnar border of the trapezium. The incision is closed with layered sutures. Denervation, hip joint, intrapelvic or extrapelvic intra-articular branches of sciatic, femoral, or obturator nerves. The physician makes an incision overlying a nerve of the hip joint. The physician uses a posterior approach to the sciatic or an anterior approach to its branches, the femoral or obturator nerves. The physician dissects the tissue to locate and isolate the nerve. The nerve is cut and the incision repaired in layers. Denervation, hip joint, intrapelvic or extrapelvic intra-articular branches of sciatic, femoral, or obturator nerves. The physician makes an incision overlying a nerve of the hip joint. The physician uses a posterior approach to the sciatic or an anterior approach to its branches, the femoral or obturator nerves. The physician dissects the tissue to locate and isolate the nerve. The nerve is cut and the incision repaired in layers. Discission means an incision, as in treating cataract, of the capsule of the lens of the eye. Discission of vitreous strands, without removal, pars plana approach. The physician makes a small incision in the conjunctiva, sclera, and choroid in the pars plana. A narrow knife is inserted to cut vitreous strands that obstruct the patient's vision. The strands generally fall away from the visual field and are not retrieved. The physician repairs the pars plana incision with a layered closure and may restore the intraocular pressure with an injection of aqueous or vitreal substitute. A cataract specialist might approach the dissection through a limbal incision, at the corneal scleral juncture, instead of through the pars plana. A topical antibiotic or pressure patch may be applied after either approach. Discission of secondary membranous cataract, opacified posterior lens capsule and/or anterior hyaloid, stab incision technique, Ziegler or Wheeler knife. The patient initially had extracapsular cataract surgery in which the posterior shell of the lens was not removed from the eye. But the capsule and/or the membrane adjacent to it, the anterior hyaloid, has since become opaque and must be opened in this new surgery. After placing an ocular speculum in the patient's eye, the pupil is dilated. The physician inserts a small needle, a Ziegler or Wheeler knife or special scissors into the corneal scleral juncture, the limbus, and advances it to the edge of the capsule and through to the membrane, cutting a flap in the opaque membrane in the field of vision. The physician maneuvers the instrument around any artificial lens. No tissue is removed from the eye, the flap simply opens a window of vision. The physician may close the incision with sutures and may restore the intraocular pressure with an injection of water or saline. A topical antibiotic or pressure patch may be applied. Discission of secondary membranous cataract, opacified posterior lens capsule and/or anterior hyaloid, laser surgery, e.g., YAG laser, one or more stages. The patient initially had extracapsular cataract surgery in which the posterior shell of the lens was not removed from the eye. But the capsule and/or the membrane adjacent to it, the anterior hyaloid, has since become opaque and must be destroyed in this new surgery. After a topical anesthetic is applied to the eye, the pupil is dilated. A number of YAG laser shots are focused to a point on the capsule, cutting it. Bursts from the YAG open a flap in the capsule, resulting in immediate improvement in vision. Multiple sessions may be needed to create an adequate opening in the lens capsule.